Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, guys, it's awesome to have you here because we're just having some amazing conversations with incredible leaders within the healthcare space that are really painstakingly shaping the future of healthcare. And we're really passionate about a few different things here. We're passionate about healthcare innovation, we're passionate about leadership and access. And if it's your first time tuning in, let me just take a quick step back and tell you what we're really trying to do here. So the story that we're trying to get done here is we want to talk with real folks that are truly innovating within our space and just sort of give them the platform to be able to share their story with our community and ultimately with the world. And if you haven't had the opportunity to check out any historical interviews, just wherever you are, wherever you're listening to this or watching this, just do me a favor. Just hit the subscribe button now so that any new interviews come directly to you and you will be greatly entertained. So our field, it's constantly evolving. There's a lot of shifting that's happening, and it's crucial to have leaders and doers that are coming onto the show that are envisioning a brighter future for healthcare, ones that embrace innovation and are doing things to address many of these pressing challenges. And as you know, if you've been living in our world as it is today, there's a lot of challenges, which means that there's an immense amount of opportunity. And our next guest on the show is one of these leaders. So Rachel Kern is the Senior Vice President of First Trust Capital Partners. So Rachel serves there. It's a firm that really focuses in on early and growth stage investments, focusing primarily on healthcare technology and also on financial services. So Rachel's role is pretty pivotal. She spearheads the healthcare strategy, driving both new investments and also managing the existing portfolio. So before her tenure at First Trust, Rachel had a very nice 5-year tour of duty in investment banking, which we'll talk about a little bit today. Um, and her background is just pretty fascinating. She's got a really strong commitment to just being an active board member and across several organizations, including Mid-America Healthcare Investors Network, Sonara Health, Referral Point, Senderide, and Conversio Health, amongst others. And I think just what sets Rachel apart from her just vast experience, she's just so rigorously honest. It's great. It's a breath of fresh air for those that are, growing up in New York where people are just they tell you how it is. Rachel tells you how it is. So she's very practical, very inventive, and I think she just brings a dose of reality and creativity to a lot of companies that are trying to problem solve and get things done. So Rachel, welcome to the show. It's great to see you. How are you?
Thank you. Doing well. I think I have to comment. My dad is from New York, so I think that's where I get a little bit of the candor from.
Yeah, yeah,
Um,
yeah. So I mean, listen, your background's fascinating. We've talked about this for a long time, and listen, you studied history, international relations, economics. 3 fields that I think sometimes don't necessarily mesh into venture capital. What's the weirdest way that your background has actually helped you in deal making?
yeah, no, that's actually a great question and one I actually like to talk about. Given I'm a history major, people always are shocked that a history major came into venture capital and investment banking. But I think what it is history involves a lot of critical thinking and looking at the past and saying, what patterns am I seeing here that are going to
Hmm.
predict future trends, and what can we avoid to avoid those pitfalls? Right. The number one thing is history often repeats itself. So how do you avoid repeating history that was bad, and how do you repeat history that was good? And so being able to look and I like to think of venture capital as an apprenticeship to begin with anyways. I think you're always
Yeah.
constantly learning and evolving. And so what have I learned in the past that works? What do I see in terms of founders, care models, different ways of scaling businesses that have worked? Where have I seen it gone wrong? And how do you avoid those pitfalls? And you're not going to be right every time. And so just knowing that, I think helps as you're analyzing new companies and different problems within the portfolio alone.
Mm, so interesting. I mean, look, you've sat across from lots of founders, pitching sort of their life's work. What's like the biggest red flag in a pitch that makes you kind of want to walk out of the room either immediately or just exit exit left from the Zoom meeting.
I honestly think the founders that have an inability to listen, like I said, I'm not always right, but seeing how people discuss different problems and understanding your market and just challenging some of the issues you see in the pitch deck, whether to see if they're taking in the information or just saying, no, you're wrong, I'm right. Those are
Mhm.
companies that I often don't like to work with because they're not open to other ideas because it's their baby, right? At the end of the day, they built this from scratch, and it's the again, you're not going to know everything, but you're going to know a lot of it. So just being
Mm.
open to feedback, I'm not saying you have to take it, but at least being open to it, I think is the number one thing that makes me run. And then the second thing, I know you didn't ask for a second thing, but I'll give it anyways, is when you go into a pitch and somebody says, well, there is no competition out there. And right, it's if there's no competition, there's no market. So even though your company's probably doing something very different than other people, there should be some parallels where you say, look, it's similar to this, but we're taking it a step further and no one's doing this aspect, but I can show that I have a market and that I'm solving a unique problem.
Mm. That's very interesting. Is there a healthy dose of pushback that a founder can give back to you without coming across as super defensive, very touchy-feely about there? Is there a tasteful way of being able to do that?
Oh, absolutely. Because I think you have to believe in the business model where it's, look, I see your point and here's why it doesn't, here's why I don't think it works. And then you could have that constructive back and forth around, okay, I see that point, but have you thought of this? And then you could keep feeding into it. And at some point it evolves where maybe there's only one thing you take away from it out of the whole thing, or it helps me understand it better. So I think the pushback is good. I think it's that constructive back and forth that I like
Mm.
to see rather than just saying, no, you're wrong, right? There's the constructive
Yeah.
dialogue that needs to happen.
Yeah. 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 There's a really good book that was written. It's called like, nonviolent communication. So so there's a way of framing something. Um, Switching gears, I have the luxury of just knowing a bunch of VCs, and they often will say, look, we invest in people. We back the jockey, not necessarily always just the idea, not just the companies, but sometimes, come on, there's got to be a time where maybe you love the idea, but really knew the founder was maybe not a number one. I'm just going to be nice about that. I'm not saying they're an absolute disaster, but maybe they're not a number one. How do you break it to someone knowing that they're not the right fit to run their own company?
So I've had to do that before where I've really loved an
Share the
idea.
story. Share the
It's
story.
real story. Not going to name names here.
Yeah, redact the
Um,
names.
it's you have to remember at the end of the day, these are people too, and they built these companies from scratch. So there's a way of dealing with this. Again, VC is very much a people oriented business. So how do you do it in an empathetic way that shows? And it doesn't work all the time, but sometimes you can say, look, here are your skill sets and you're really strong in these areas, and I think the company still, sorry, I'm going to rewind here. There's two ways you can go. You can remove them from the company completely, or you can find a place for them at the company if they're willing to play. And so I think these are your skill sets, and I think you've brought some real value to the company, except your skill sets are better served in this role. Would you be open to stepping down and moving to this role and letting someone else bring the company to the next level? You've laid the groundwork. The idea is great. You still own a lot of equity. It's just now the company's become bigger than what your talents are, and not everyone is. uh, the statistics around founders making it to an exit are unfortunately pretty low, and that's because companies scale beyond different skill levels. So it's the having the humility to know that the company is grown beyond a skill set and being able to still be a team player. I've also had cases where, as you mentioned, I like to be pretty upfront where I said, hey, look, we love your business, but if you take our money, I think we would like to see a different leader in this role. So it's your option of taking our money or not, knowing that that might happen. And so I think
Mm.
building that trust among founders is really important because then they know your objectives going in and there's no surprises and they're willing to work with you, not against you. And then you're always going to have the people that are against it and really want to continue to be those CEOs. And when they become combative, unfortunately, it's we're gonna have to move on from you. And those are tough conversations. That's the worst part of my job.
Yeah, I was going to say that what's sort of the hard truth about healthcare investing that no one in your sort of position even likes to admit publicly?
I would honestly say that the difficult conversations around leadership changes, strategic direction. I also think when a business isn't working and you say, look, we're going to stop funding. We can't fund this anymore. I I think those are actually obvious, but I think people often forget
Mm.
about it that, at the end of the day, we have a job to do too. And so we have to make those hard choices, even if it is uncomfortable to let people know, because at the end of the day, if you stop funding a business or say we're going to sell your company, that's just heartbreaking for the people all involved trying to build that
Yeah.
company over years and years. So never that. That is by far the worst part of the job.
Even just sort of thinking along that same thread, I mean, healthcare is notorious for its bureaucracy and slow adoption. Have you ever seen a really innovative company that just say objectively, it was incredible, but it died because the system simply wouldn't sort of budge? Any stories that come to mind around that?
Yeah, I actually, it sadly happens a lot because, as you mentioned, healthcare just takes forever. Sales cycles, 18 to 24 months. Investor patience wears thin. Luckily, there's funds that have a fund life cycle. And so you have to be able to execute within that fund cycle. And so I've definitely seen businesses where I've actually talked about one. Um, it was on the focus on consumer side of healthcare where it was, man, if this company came to market 5 years later, it probably would actually be a great business today, but it took so much cash and time and it never took off that it eventually it did get sold. It got sold. So it still is around.
Hmm.
Um, but it happens all the time. I mean, they call it there's a gap between like a seed and series A where it's Death Valley. And so how do you continue to be innovative and watch your cash burn to make sure that you can get out of the Death Valley in time to really build the business and let it take off? And I think where we sit, we tend to invest earlier, but that's because we can be patient capital and we know healthcare takes a long time to build. So having that discipline around, we know that this company is going to take 10 years to really get to a point where it really starts scaling. That happens all the
Hmm.
time in healthcare.
Yeah. Well, you mentioned about the firm. Let's take a few minutes, maybe just talk about the firm. Talk about maybe your areas of focus. I didn't really touch on it a little bit, very little, but maybe you can kind of share that story a little bit more before we kind of dig into some of the other areas that I think might be fascinating.
Yeah, so First Trust Capital Partners is affiliated with First Trust, which is a large asset manager. We're a small part of the firm. We're investing firm and partner capital off the balance sheet into financial services, financial technology, and then healthcare tech and services. We're a bit unique that we don't have the traditional LP structure, so it allows us to be more patient with our capital. We can hold for longer. We can deploy and be flexible in how we invest, which is really fun because it gives us a lot of optionality when it comes to our investments. Um, and because of that, we can be in companies for longer than traditional funds because if we see the value forward, we're going to want to stay in and continue to help those companies as long as we can and continue to grow
Right.
value.
Mm. So knowing that you all are sort of long term in it for the long haul, and I know you meet with a lot of founders. but is it similar? I'm kind of use this example like in real estate. If like you're looking for a house, you walk in, within the first 5 seconds that you're going to buy that house. Is there anything similar? Like if you're talking, you're meeting with a founder, no pitch deck, no fancy numbers, just a conversation. Like, what's your secret in knowing whether they're worth betting on? And do you actually know in the first meeting?
No, I think it's building a relationship for sure. I think what
Okay.
you can tell in the first meeting is, do I believe in their vision of where healthcare is moving in the future? Are they
Mm,
just throwing out buzzwords that really don't mean anything to me and just jumping in because it's the cool thing to jump into? Or are they truly trying to solve a problem into the future that, knowing healthcare again takes a long time to build. In 5 years, this is actually going to have a profound impact on healthcare spend or return of investment, etc. I think that's that conversation within after hearing the pitch. But I think from, is this the jockey I want to bet on? I think that's a building of the relationship.
mm. Well, you've bet and have worked with some pretty impressive entrepreneurs. Um, what were some of those traits of the jockeys that made them different? Like, you mind sharing some of those?
Yeah,
What made them stand out?
I think persistence is definitely key. I think having, again, being open minded and being strategic around where you want to start, having a focus at the beginning. I see a lot of founders that go after a lot of things, and so it's, how do you
Mm,
stay focused? There's a lot of things you can do. Where is your focus? And then I think it's the, again, willing to take in feedback, even if they're not right, and willing to consistently learn and pivot, and being able to manage quite a few tasks at one time, because they're going to be thrown at a lot of different directions. Can they wear multiple hats and hire team members that can wear multiple hats?
mm. Any entrepreneurs that have come through sort of the Death Valley, as you mentioned it, that trough, when they kind of look back, it, do they sometimes feel like, man, it was actually good for me to go through that sort of low period? Because I think you see a lot of stories around sort of these astronomical rises. There's not many of them, but sometimes it's just, I guess what I'm trying to get at is like, is the PR actually helping? Is the PR actually helping the cause? Because there's a lot of entrepreneurs that are out there that are really struggling. There's a lot of silent suffering. Not many people talk about it within the industry. How do you sort of perceive the ones that are, it seems as though the ones that are actually
You
capturing the
can't,
capital, though they don't really need it.
yeah,
Like they already have momentum.
you can't have you can't go at it alone. I think, right, we're people at the end of the day. I think it's important to surround yourself with other CEOs, learn from other CEOs, have someone to talk to, right? Talking to an investor is a lot different than talking to a chief operating officer, but being a CEO at a startup is one of the loneliest positions, and you're often on an island. And so I often think, how do I, as an investor, continue to motivate and help and allow that founder to run ideas by me, so he's not alone on this island caring for a team of 5 people, where he can't go and say, man, things aren't working here, but how do I move around them? Or they do have that strong partner, co-founder, that they can kick around ideas for. But it's really surrounding yourself with somebody that you can talk to, so you're not stranded on an island thinking you're going through things alone and can't handle everything. I think it's being honest and open of what the challenges are, so that people in your circle, especially your investors, can help you, rather than hide things, because that's only going to hurt you more. If you say, hey, look,
Yeah.
I have this problem, I'm kind of at a loss what to do, I tried to do X, Y, and Z, it's not working, have you seen this before, can you help me out of it? um, and just having that conversation, I think, goes a long way.
Well, talk about the interpersonal. interconnectivity amongst the portfolio companies, what's that like? Do the CEOs that what's that collaboration like? Is that sort of a tight-knit community, or does that take a lot of work to be able to create and foster this level of connectivity?
So I say it goes back and forth. It depends if there's synergies among portfolio companies. Those connections are fairly easy because they can help and support each other and build off of each other, which is awesome. And that's what we always try to look for in our portfolio is how do we keep adding portfolio companies that can help other portfolio companies to really create this network approach. I think in terms of the ones that are more on the island, it takes a lot of effort. Can we
Mm,
do a CEO summit and get them together and share ideas? How do you get them plugged into um, other CEOs who experience similar problems? That takes a lot of time and resource just to make sure that time's limited, right? And you're building
yeah,
businesses. So how do you make the most efficient use of time when doing that? I think that's an area that we can improve on ourselves at our firm, but um, we want that to happen. We would love all our
yeah,
CEOs to connect and learn from each other.
totally. I want to switch gears for a minute, and just talk about something. I want to talk about like women in venture capital. No, no BS here, just truth. You were you were named one of like five women to watch and venture, which is awesome. And I've gotten a chance to kind of see you grow through your career, and it's amazing. Do you ever feel like those lists, like, do they help actually push change, or do they sometimes feel like a PR exercise?
Honestly, I think they feel more like a PR exercise. I wish
Mm,
they would create more change. I I think a lot of women truly don't know that much about venture capital because it's not something we're exposed to. I mean, myself, when I was before I did healthcare growth partners, I was a legislative assistant. I didn't know what venture capital was at the time, which is funny now looking back at it. But it's how do you get more exposure to women? I mean, even if you look at women in finance, investment banking, it's growing. Don't get me wrong, but it's still a small amount of women in venture capital.
mm. I'm just, what are some of the barriers?
I it's you got me on this one. Um, I think trying to raise a family. I think the world's shifting where now you can have more of that work life balance and be able
Mm,
to get out of the office for 2 hours to go
hmm
attend a school play where in the past that hasn't always been the case. You were
mm,
expected to work 9 to 5 and being a mom for a lot of women, it takes a village to juggle travel and all the work that's
yeah.
required to go into venture capital. So I think that's one barrier. I think that a lot of firms have been solely male operated for a long time. And so getting women in those roles and promoting them from analyst to partner just also takes time. And that's why you're seeing the percentages go up. But it's been a male dominated industry for a long time. And so you have to start somewhere. And so hiring more younger females, I think, would help
hmm
expedite that. Um, but I think those are like the two biggest. But I don't know if you've heard anything different. I'll put it back on you.
Look, I think VCs in general aren't the only industry that make it difficult to break into. I think there's a number of industries, not just VC, private equity. I mean, even when I work with a bunch of doctors and surgeons, like the majority of the surgeons that I worked with were male, not female. You would see some female surgeons, but they were very specific in certain specialties. Pediatrics, a pediatric surgeon, pediatric orthopedic surgeon, handful of female surgeons. So I don't necessarily have a sort of a magic bullet on solving that. But my question is if you were to looking back and have a conversation with your 20-year-old self prior to knowing anything about venture capital, is there more awareness that we can create about this track as a potential career track? And what would you tell your 20-year-old self? What advice would you give to that 20-year-old self of Rachel?
Yeah, I think my biggest advice to myself is always stay curious, because I think that's what led me to venture capital. Is
Yeah.
I always want to know more, and I always want to solve problems, and I keep wanting to learn, and I think that's what venture capital is. Now, if I was looking in college, how do you promote? I think it actually starts in high school. How do you give high schoolers more information about what industries are available to them? And how do you create in college more of these clubs, societies, whatever you want to call them, that emphasizes different career paths that people can take? A lot of times, I think um, you're subject to what you know. If your mom
Yeah.
was a doctor, you probably want to go be a doctor. If your dad was a lawyer, you'd probably go into law. And I think a lot of that, having different exposure and giving people more opportunity to see different career paths out there than the traditional paths that they grew up with in their family and friend circle, I think goes a really long way. And I think those conversations have to start early on. I mean, you're seeing a momentum of STEAM education in elementary school. I think that's opening the eyes to a lot of different career paths for women that haven't always been the case. And so the more we can expose early on, I think the better that would be. So I know you said 20-year-old self. I think it actually starts earlier than that. But
Okay.
there's a lot of navigating after college. I mean, I remember when I was in college, when I first went, I don't think I ever told you this. I thought I was going to be an engineer. I got accepted in an engineering school. Um, that was the career path I thought I was going down. Pivoted a few times. Like I said, worked for a legislative assistant before I got into healthcare banking. Those are all three very different career paths, but it's finding what you love and what you enjoy, and having a job where you wake up and you're excited to go to work makes such a difference. Um,
It does. It does.
and so I
It's a
love
whole
what I'm
different in
doing,
the
and
world.
I'm so lucky that that my boss has supported me and helped me grow and became like one of my strongest mentors. Like, I'm very lucky that I had that in my life.
Yeah. I mean, shout out some of your mentors. Who are some of your mentors that you're like, they're your go-to people? Name
Yeah,
them.
so I mean, my boss John Phillips, he's been a mentor for a while. Tanya Copeland, Effie Carlson, um, Pat Klein, they all have helped me and grow, and I'm not afraid to ask them tough questions about, hey, I'm having a hard time here. How do I navigate this? How do I continue to grow? I think those, having mentors around you, they're hard to find, and
They're hard to
you,
find.
you can't force a mentor on yourself. So it's building those relationships where you build the trust in relationships, and they want to invest in you as much as you want to invest in them. um, and
Yeah, it's a two-way
so
street, by the way.
it's
They're
a
probably
two-way
learning just
street.
as much from you as you are from them. That's what I've
I
learned.
I agree. You can't force mentorship.
Hmm. So I'm not going to ask you to like look into your crystal ball into the future, but what's quote unquote a hot trend, in our space that you think is
Besides
completely
AI,
overhyped, that you think is completely overhyped.
I'm not saying AI is overhyped, because that would be crazy.
Right.
That would be like saying the
Yeah.
internet wasn't going to take off in the 90s and 2000s. But I do think there's some use cases of AI that are overhyped. I think you have to be very selective when you're using AI within healthcare, because at the end of the day, healthcare is around a one-on-one relationship between a patient and a physician. So AI
Hmm.
can't change that. But um, there's a lot of different parts of healthcare that I think we talked about that a lot of people jumped into because it's a buzzword. They're solving real problems, but it's you look at what blockchain was, and then before that it was interoperability. And I think
Right.
right now it is the AI trend, but it's not overhyped. I don't want to call it overhyped. I think that's the wrong word.
Hmm.
I just think you can't put AI into everything that's healthcare related.
Right. Well, what trends are you very bullish on? What are you very excited about as an investor now?
I think using technology to solve problems in Medicaid is going to be huge. Same with Medicare. I think continuing to build around the picks and shovels around value-based care continues to be important. And honestly, looking at different care models. I think at the end of the day, healthcare was built around the provider, and now we're moving to healthcare around the consumer. So how do you blow up healthcare to be an N of one around an individual that needs care?
Mm,
And so what technologies are going to sound that? And I think it's on the ground care teams that are truly going to drive meaningful results in cost of healthcare and impacting engagement. And
mm.
technology
Interesting.
can enable a lot of that, but at the end of the day, it's one-on-one people focused.
Interesting. All right, we're going to wrap up with a little lightning round. Just some
Oh
rapid
boy.
fire questions. Friendly. Yeah. What's the best investment you've ever made?
Um, I can't say that. First trust will get in trouble. I'll get in trouble at first trust.
I was going to say the trick answer would have been the best investment you ever made was in yourself.
Oh, yeah, you're right. I thought I was going portfolio wise. Always bet on myself. You know that.
What about, an investment decision that still haunts you? The one that got away.
There's a few of those. I think having an anti-portfolio is great learning. Is why did we pass and why did we think we were wrong about that investment? Um, there's a few out there.
Any that are worth naming?
Um, I'm trying to think off the top of
If
my
you
head.
can't, not a big deal, but just staying curious. What about what's like an industry jargon that drives you absolutely nuts?
I mean, all like the just office jargon, I think, is what drives me nuts. Like the circle back, follow up, like the follow ups, all those buzzwords that come around in email, and I'm guilty of them too. But it always makes me laugh.
Well, listen,
Because
you're
you hear them
clearly
on every
crushing it.
call.
Yeah, you're clearly crushing it in venture capital. If this wasn't your career of choice, you see yourself doing anything else? And if so, what?
Honestly, I think now being in healthcare, I would stay somewhere in healthcare because I think we have just such complex problems and there's so many things that can be fixed and so many people that need care that I don't think I could step away from it. But someone else asked me this question: if you remove healthcare, what would you do? I honestly, this is funny. I guess it shows a lot of my personality. I would love to find music for the background of TV shows, like the eccentric music, no bands that no one's ever heard of. I think that would be a really fun job.
It's interesting enough. That was actually one of my questions. It's like if you had a go-to song, like needs to pick you up, needs, get you out of whatever you're doing, but like get you going. What's that soundtrack?
Oh, it's probably like just some like high energy country music, um, for sure.
Well, you are in Nashville. And just what do you hope for people in venture capital to kind of remember about your work?
I just hope at the end of the day, it's more about the companies we invested in that have made a profound impact on healthcare. It's not about me; it's the founders we're supporting.
Awesome. Rachel, it's been awesome having you on. Appreciate it. It's been a while in the making, so I'm glad we were able to make this happen. And for those that have kind of tuned in, if you found this particular conversation to be enlightening, please share, let us know what you thought. And if you wouldn't mind, reshare it, post it, like it, subscribe to us. Rachel, you're obviously always welcome to come back on the show and give us more updates. Give people just a sort of a blurb how can they follow you, your work, the work of First Trust Capital Partners. So give us a little parting commercial.
Yeah, happy to. I share a few things on LinkedIn. Have a LinkedIn account. We post all our new investments on our website, and then we're always around for email and chatting with new opportunities.
Awesome. Thanks again, Rachel, and I'll see you soon.
All right, thanks, Michael.